Methicillin-resistant Staphylococcus aureus, or MRSA, is a small bacteria, a type of germ that can cause big problems. Staphylococcus aureus, or staph, is found on the skin and nose of up to 1 out of every 3 people. Most of the time, a person simply carries the germ with them but doesn't actually have an infection. This germ doesn't often cause problems for healthy people, but a strain of staph that is harder to treat can cause problems, especially for those with other health issues. MRSA is a type of staph that is resistant to some of the common antibiotics that are often used to treat staph infections. While there are antibiotics that can fight MRSA, it can be more difficult to treat. The best plan is to prevent getting MRSA in the first place.
What the Department of Veterans Affairs decided to do was screen every admission for MRSA by doing a nasal swab. And we do this rapid testing, a molecular testing. Within hours, we know if they have MRSA in their nose. And if they do, we put them on special isolation precautions.
Some veterans carry the germ without having any sign of infection. Other patients may have infections of the skin or other areas caused by MRSA. All VA hospitals use contact precautions when dealing with MRSA-positive patients. Contact precautions means that when it is possible, a MRSA patient will have a single room or a room with another MRSA patient. Healthcare providers will use protective clothing when caring for a MRSA patient. Protective clothing includes wearing gloves and gowns. As a general rule, visitors don't need to use gowns and gloves, but they are asked to clean their hands before and immediately after visiting the patient. If visitors are giving direct care, such as learning how to change a dressing that they will do at home, then they will wear gloves and a gown. Gloves and gowns are removed and disposed of before leaving the patient room. Hand hygiene with either alcohol-based hand sanitizer or a 15-second soap and water hand wash is always required after gloves and gowns are removed. Cleaning the room is also critical to good infection control. Environmental management makes sure that all rooms are disinfected before the next patient goes into the room. Healthcare providers, visitors, and patients must practice good hand hygiene in order to prevent the spread of MRSA. To wash your hands properly, turn on the water and wet the hands. Add soap and rub vigorously for at least 15 seconds. Sing the happy birthday song twice or the alphabet song once. Rinse hands and wrists. Dry with a paper towel from the fingertips to the wrists. Use the paper towel to turn off the water. If hands are not soiled, it's preferred that patients, visitors, and healthcare workers use hand sanitizer that is alcohol-based. Good hand hygiene can help stop the spread of MRSA and other germs that can harm patients.
Hands are the main way that we move bacteria from one place to another, and that's why hand washing is so important. If we do a good job of washing our hands, we can break the chain of transmission. We can stop carrying bacteria from one place to the next.
Good morning, Mr. Bates.
The patient is at the center of the situation. Both medical personnel and visitors interact with him. Patients should feel comfortable reminding anyone who comes into contact with them to wash or sanitize their hands before they touch them. Healthcare workers appreciate the reminder. Though it may not seem that important, this simple step really can make a difference.
And one of the key things that physicians and other healthcare providers, such as nurses, should be doing is hand hygiene, we call it, which means either washing with soap and water or an alcohol-based gel to cleanse their hands before touching them. And if they see a provider not doing that, they should feel free to speak up. After all, it's their health, and they have a right to expect safety when they come into the hospital.
Another important factor in keeping MRSA and other infections under control is for everyone to use antibiotics responsibly. In some cases, ill patients demand antibiotics, even in situations when antibiotics aren't indicated for their condition. Antibiotics only work on bacterial infections. They can't kill viruses. Many viral infections run their course and then get better. Taking antibiotics doesn't make these viral infections get better sooner. Listen to your doctor and only take antibiotics if he or she really thinks they will help.
The best thing to do is not to overuse antibiotics, and also if you are on antibiotics for your infection, then you need to take the whole course, not just, half of it.
Anyone may carry MRSA on their body, but most healthy people don't usually have a problem with the germ. It may live on our skin or other areas of our body without causing infection. People can pick up MRSA from touching someone who has MRSA or is a carrier. They can also get MRSA from touching a surface where the germ is. If the germ is on their hand and then they touch their eyes, nose, or skin, they can get MRSA. People can also acquire MRSA if they use personal items like a towel, toothbrush, or razor used by someone who has MRSA. MRSA can live on people, surfaces, and items for weeks. Patients in ill health are more at risk for getting MRSA. Some conditions that make people more susceptible are being over age 65, having a break in the skin, having wounds, and spending time in a crowded place like a hospital, nursing home, daycare, or fitness center.
It's patients in the hospital that are vulnerable because they have breaches of their integrity. They have incisions from surgery or intravenous lines or other types of catheters which make them susceptible to get these MRSA infections.
How can people recognize if they have a MRSA infection? It's not always easy to know for sure without a medical exam and a lab test. MRSA can be an area that is red or swollen. It can feel warm to the touch and it might be tender or painful. Many times, individuals will think they have a spider bite. The lesion may have fluid inside and feel movable. It might have a yellow or white center or a head. If patients notice any spots like this, they should make sure to alert healthcare providers.
If you have an MRSA infection, your doctors need to know about it so that they can select the right antibiotic.
The sooner MRSA is diagnosed, the sooner the patient can begin getting better and the safer it is for those around him. When we return, we'll learn how patients can take an active role in preventing MRSA in the hospital and at home. Veterans Health Administration provides education to all patients on protecting themselves from MRSA and other infections while in the hospital. To achieve the best results in preventing patients from contracting MRSA, it is important that the patient take an active role in his or her own care. The first step is determining if a patient is MRSA positive. While in the hospital, all patients, but especially MRSA patients, need to take the lead on communicating to those providing care and even visitors about requirements for good infection control. Patients should make proper hand hygiene a high priority. They should ask all healthcare providers and visitors to sanitize their hands or wash them if they are visibly soiled. The patient should clean his hands as well. Hands should be cleaned when entering and leaving the room. MRSA patients should limit their movement outside of the patient room to minimize infection exposure to others. Patients should make sure that all medical equipment that they use is also cleaned and disinfected regularly. Medical equipment includes crutches, wheelchairs, and even wheelchair gloves if used. Just keep in mind if a patient comes into contact with an item, it's possible to spread the germ to that item. It's especially important for a patient to not touch his open wound. If a bandage becomes soiled, loose at the edges, or is damaged, the patient should seek help from a healthcare professional and get a new bandage. There's no doubt about it, preventing the spread of MRSA in the hospital takes teamwork from everyone directly involved with a MRSA patient and is equally important for those who don't want to get the infection. When the big day finally comes for a patient to go home, it's critical to his recovery to understand his discharge instructions. MRSA patients add another set of instructions to their care. Once the MRSA patient gets home, he has to follow much the same guidelines as he did in the hospital. Proper hand hygiene is still very critical to a successful recovery. As in the hospital, it's important for the patient, caregivers, and other family members to wash or sanitize their hands often. The patient should also clean his hands before holding or feeding a child. Don't forget to continue taking any antibiotic or other medications exactly as prescribed. Don't take half doses or stop taking the medication until the entire prescribed course is completed. Wound care for the MRSA patient is fairly straightforward. Make sure that all wounds or skin lesions are covered with clean, dry bandages. When changing a bandage, the patient should clean his hands and then put on disposable gloves. Care for the wound as instructed and then remove the gloves inside out. Carefully dispose of the gloves, then wash and clean hands again. Remember to never touch the used gloves after they are removed. Always wear disposable gloves if contact with bodily fluids is expected. It's important that others in the family don't share personal items like a razor, toothbrush, or towel that the MRSA patient is using. Use cloth towels for drying hands only once, or keep paper towels handy to use instead and then throw away. Soiled linen should be changed and washed routinely. Wash and dry those items and the MRSA patient's clothes in the warmest temperature recommended on the labels. It's okay to use regular laundry detergent. Clean rooms and personal items daily. It's okay to use a store-bought cleaner, or patients can make their own using 1 tablespoon of bleach in 1 quart of water. Make sure that utensils and dishes are washed as usual with dish detergent and hot water. If a dishwasher is available, use that. MRSA can cause serious infection. It can be controlled if all healthcare team members, including caregivers, family members, and the patient, follow established MRSA guidelines. MRSA in the rest of the population can be prevented if everyone does his part. Clean your hands with hand sanitizer or wash your hands. Make sure that those around you do too. It's okay to remind everyone to clean their hands.